to remember that never work for only yourself. I mean, do not ever do thinking about only you. No, our life is not only you. It is only for us, okay? For humankind. You should work like a human helping hand. So this is a picture. You can see full of balloon. Can anyone tell me, can you see a picture full of balloon in a room?
Yes, ma'am.
Okay. So this is a moral of the story in a short 2-minute story. One teacher gave hundreds of balloons to the children, okay, in the school. And there were like 50 or 70 children in the school. And the teacher gave all different color balloon. Different color of balloon. That is green, red, blue, yellow, okay, different color of balloon. And every balloon, the teacher said, write your own name. Write your own name on the balloon, okay? And inflate the balloon. Balloon take fulao, inflate the balloon, and then leave it in the corridor. So every student write their name on the balloon, inflate it, and then leave it in the corridor, okay? And then teacher said that now you find your own balloon. Which is your balloon? Try. Teacher said, I am giving you 10 minutes. Within 10 minutes, you have to search your own balloon that you write your name. So balloons were mixed up, you know, there were multiple colors. All the balloons were mixed up. And any student did not find, no student could find their own balloon, because there are lots of blue, lots of red, lots of yellow, lots of white. So all the balloons are mixed up. And the students did not find their own balloon. Okay. Now the interesting part of the story. Then the teacher said, okay, everyone take one balloon and give it to your friend whose name is written on the balloon. Okay, suppose I am Tamanna. I got one balloon. The name is written Ilhama. I got another balloon. Name is written Rihana. Now I know my friends. Okay, now I know my friends whose name is Ilhama, whose name is Rihana, because I know my friends. So I gave those balloon to Ilhama. I gave those balloon to Rihana. Okay. I mean, I gave my balloon what is written on the name. I know my friend. So I gave hand over the balloon to them. After 5 minutes, everyone got their own balloon because someone searched it and then they gave it to her or him. So everyone got the balloon. But who gave the balloon to that person, that child? Another person. That means the moral of the story is that if you search happiness for yourself only, you will never find it. But if you give happiness to others, it will come back to you. Okay? It will come back to you. So always try to do good for the people. Even they do not return you back, even not a thank you. Even they do not give you anything in return. Always try to give the goodness, try to give the kindness, happiness to another people. Okay? Indirectly, it will come back to you. You don't know in which way it will come back to you. Okay? So the moral of the story is that when you learn, you teach. When you get, you give. Okay? This is the moral of the story. How was the story? Was it helpful for you or no? Am I audible?
Yes, ma'am.
Yes, ma'am. Yes, ma'am. Awesome.
Yeah, it was really helpful. Yeah.
Okay. So whenever you will pass, you will try to give back. Okay?
Yeah.
Promise me today that whenever you will pass, you will give them back.
Yes, ma'am.
Yes, inshallah. So this is our today our topic. Dr. Bella is the candidate today. Dr. Bella, are you here? Dr. Bella, she messaged me in the morning. She wants to do the session. Dr. Bella, are you here?
I'm here. Assalamu alaikum. I'm here, but actually my net is not stable. So I listen.
Okay. Who wants to do this then?
Can I do?
I am ready as well. I am having exam, MRCPI Ireland exam on 17th.
Okay. Who is
Yeah.
that? Doctor?
Dr. Shabir here.
Dr. Shibir and Dr. Yasir. Okay, I think Dr. Yasir, you will do the second session. Dr. Shabir, you will do the first session.
Yeah.
We have 2 sessions today. So Dr. Shibir, you will do the first one.
Yeah.
And Dr. Yasir, you will do the second one. Okay? Okay. Because both of you have exam soon. Yeah. So I'm giving you your first scenario. This is your first scenario, Dr. Shibir. Shabir or Shibir?
Yes, Shabir, yeah.
Shibir. Okay. This is your first scenario. Okay. Can you see the screen?
Yeah, I can see the screen. So Rehan, should
can,
I read?
No, you can read. Everybody can read their own.
Yeah.
By that, you can concentrate more.
Yeah.
Okay. I'm giving you exactly 2-minute time because in exam, you will get 3 minutes, but that 3 minutes is very little. So I'm giving you 2 minutes. Okay.
So should I start now?
Yeah, give me just 1 minute. I'm closing it because you cannot see this while you are talking. That's why I closed it. Okay. Give me just 1 minute. Put my timer on, then I will tell you.
Hello.
Wait. I'm just telling you. Wait, just 1 minute. I'm doing something. Yeah. Six-minute station. Then in the 6 minute, you will get a bell. Okay. Warning bell. Then after 9 minutes, you will get another This is now in UK, it is 6:30. Okay, 6:30 p.m. So I am getting one alarm. And that is, wait, 1800, 30, 36. Yeah, start. You start your session.
Hello, my name is Shabir, and I am one of the PEDS registrar from PEDS ED. Am I speaking to surgical registrar on call?
Yes, that's me.
Okay. Is it a good time to talk to you about a patient?
What do you mean, good time? You referred me, the patient. Talk to me about the patient.
Yeah. I have. Are you able to talk to me regarding a patient which I have already referred to you?
Is there any way I can escape your referral? Tell me. Is there any way? I want to escape it, but you are calling me 100 times.
Yeah, I know. But actually, you know what happened, that the Rehan, a 6-year-old child who presented to us in the ED with the abdominal pain, initially we was thinking of UTI and acute gastroenteritis, but we also did the bloods, and there was a lot of other bloods to chase. So I chased our bloods later on, and his blood counts are on the higher side. So we are thinking of the acute appendicitis, and we would like you to see that child.
Yeah, I'm here. Show me, tell me.
Yeah, so Rian has, I examined the Rian, and he is having some tenderness on the abdomen, and his bowel sounds are positive, but he is having tenderness, and his pain started in the periumbilical region, and then it shifted to the right iliac fossa, and is also WBC count is also raised, and his CRP is also on the higher side. And there is also...
Wait. You are telling me the thing that you learned from book. You are not telling me the thing that is written in the referral note. Let me remind you.
Yeah.
The referral note, it is written, pain is now in the pelvic area, number 1.
Mm-hmm. Yeah.
Number 2, in the referral note, you have said blood and urine report still not available. It did not come. You have to collect them. So how are you so sure that this is a surgical abdomen? I mean, every abdominal pain you will refer to us? Are we having any, I mean, we are what? We are human, right? How can we say so? How can we see every abdominal pain? I mean, you should have some guideline.
Yeah, I can understand. I can understand. You must be busy in the operation OT and all those area. But this child presented to us with a typical typical history of acute abdominal pain, suggestive of the acute appendicitis, as it started in the periumbilical region and then shifted to the pelvic area. And moreover, the child mother is very much concerned about the surgical abdomen.
Child mother is concerned?
Yeah, she is.
Are you a doctor, or the mother is a doctor? Who is the doctor here? Are you the pediatrician, or the mother is the pediatrician? What are you saying? Are you out of your mind? I mean, I don't understand. You called me 100 times. And I was in operation theater. I could not take up your call. And everybody in the hospital is already informed that the surgical consultant is not taking up the call because nobody is understanding that I am in the operation theater. Okay?
Yeah, I can understand. I can understand your situation. But this patient the history and examination is suggestive of acute appendicitis, and we have already done the bloods, but we are waiting for the results. And it will be great help for us if you could come and review this child.
Oh, yeah, I totally understand. If we review every abdominal case and then we discard it as a acute gastroenteritis, then it will be helpful for you. I totally understand. But you don't understand that we are the people who does the operation. You don't do that. And we need time for that. You know, we need time. So I believe it is not a surgical abdomen. I believe this is not a case of appendicitis. Now you tell me, how you prove?
Yeah, so like this patient, as there is no history of constipation in this patient, there is no history of diarrhea in this patient, and
6 minutes. 6 minutes. Okay, start.
Yeah, and the pen typically started around the umbilical area, and then it shifted to the in the pelvic area, and moreover, the patient also having temperature as well, also having the vomiting as well, and he is having guarding in the abdomen as well, so which is suggestive of he is developing peritonitis.
Oh, do you mean that pelvic pain is indicative of acute appendicitis then? Are you?
Yeah, is developing more guarding and all over the abdomen, and I am worried about that. He is developing the acute, he is developing peritonitis.
Oh, but I did not find any guarding, doctor. I'm not ready to take this patient to our surgical unit. I'm sorry.
Then it's okay. I will once the blood results come back, then I will let you know about the blood results, and we can talk this about later on.
Yeah, but doctor, then why you called me 100 times if you already made the decision?
So I am stopped here, ma'am. I don't know what to do next, actually.
No, it's okay. You are doing very good. Please continue. You have time. Continue.
Yeah, so actually I have already discussed, this child is already seen by my consultant as well, and our plan was to follow the blood results and also to discuss with the surgical team. And I have, as you examined previously, the patient was not having guarding all over the abdomen, but now I again examined the patient, and now he has developed some guarding all over the abdomen, and tenderness in the pelvic area, and is also vomiting very excessively, and I am very concerned about his abdominal pain.
Okay, that's very good. You are very compassionate, doctor. You are worried about every patient, but you cannot give us your every patient, doctor. We have our patient. We don't give our patient to you. Do we give?
No, yeah, you don't. I understand, but as the so I'm very worried about the condition of developing the peritonitis, because now the patient is complaining of pain all over the abdomen and is vomiting very excessively, and his pain is getting more worse and worse. We have already given the analgesia to the child, but the pain is not improving at all.
That point I can take. Yeah, worsening pain, not recovering with analgesia. Okay, that I will think about it. Yeah, but doctor, I really think that you should read about how to triage the appendicitis. Okay, I really don't think you are very much competent enough.
Yeah, I can I can understand, and I really appreciate for your time, and I really apologize that we are calling you again and again, but this is because of the child condition, as this phone is not.
Your time is up.
Yeah,
Say thank you.
thank you so much for your time. Thank you so much.
Thank you back. Okay, how you felt, Dr. Shabbir? How you felt?
I think I even didn't 50%.
No, I'm really sorry for being harsh. Did you mind that?
No, not at all, madam. I learned a lot, and it's my first communication station, and definitely I have learned a lot from this.
Yeah. They will be very rude, okay?
Yeah.
They will be rude in the exam. So don't mind. Don't mind.
Yeah.
This is just.
And madam, I want to say thank you so much, and I really appreciate that you give me the opportunity for this communication station. Thank you so much.
Thank you. It's okay. No mention. So you can understand how difficult the scenario will be in the exam.
Yeah.
Not at all like people think, okay, it's education EpiPen. I'll teach him education EpiPen. I'll teach him bronchial asthma. I'll teach him inhaler. It is not like that.
Yeah.
Some parents will be angry. Some parents will be crying. There will be DNR discussion, do not resuscitate discussion.
Yeah.
There will be discussion about organ donation. You cannot imagine how difficult situation that can be.
Yeah.
There will be educational scenario like quality improvement project, like research in pediatrics.
Yeah.
Electrolyte imbalance in pediatrics. So it is communication, I will say, the most difficult station in exam.
Yeah.
Okay, I will say, and people get zero. In communication. Yeah. In clinical station, in video station, nobody gets zero. At least you get 1 or 2. But in communication, people get zero.
Zero, yeah.
Yeah, because of the lack of, skill, of skill, how to talk to the parents, how to talk to the colleague.
Yeah.
I am very much happy that you did maximum politeness. If I were in your situation, I would be very angry. Why you are saying me I don't have any knowledge? You don't have any knowledge like that. But Alhamdulillah, you have so much patience. I was provocating you. I was trying to drag you down, right? I was provocating you, but you did not listen to me.
Yeah, now I am remembering I should reply that, okay, I will try to improve my knowledge next time.
Yes.
I should reply like this, but I totally became blank. So, yeah.
In UK, actually, if you are bullied, or if you are, this is a bullying, definitely a case of bullying by the surgical registrar, okay?
Yeah.
And surgical registrar is very rude, okay?
Yeah.
Should not talk to his colleague like that. I'm very sorry. I am not like that person. I'm very sorry.
No. It happens in real life here.
Yeah, it will happen. You are working in Ireland, so you will understand. It will happen. And this kind of situation in acute pediatrics, you will get almost every month. You will get one case like that. And you want to refer, but they do not want to take it, right?
Yeah.
But as you said, Dr. Shabbir, very good. Excellent. You said that I am very concerned about my patient. I am concerned that he is going down day by day. I mean, he's decreasing, he's deteriorating. His pain is getting worse. It was previously, it was umbilical. Now it's shifted to the pelvic area and it is fixed. There is tenderness, but there was no guarding because the surgical abdomen is not present because there is no perforation. That's why the surgical abdomen not present. Surgical abdomen means perforation. Okay? Only that time the surgical doctor will be ready to take it. Before perforation, they are not ready to take it, but the guarding, the pain is settling in one area and it is worsening. You said very well that I gave paracetamol, I gave analgesic, it is not improving. That means there is some pathology. Yes, right. But one mistake you did, you said that already I got the result, WBC count is high. Remember, never ever tell the thing that is not present in the station.
That's
station, I'm showing you In my station, there was nothing written like that, what you said. I'm showing you the leaflet again. This is the question that I gave you. See here, I'm written there. It is a Ryan Green, okay?
Yeah.
And the 6-year-old boy who presented in the OPD with abdominal pain. There was no emergency. He presented in OPD because there were last 3 days he has pain. And it was gradually worsening since this morning. He had history of constipation. You said there is no constipation, you said, but there's the history of constipation. So you cannot, you know, your voice is recorded. Everything written by the examiner.
Yeah.
So if you say the wrong things, it will be recorded and it will be judged that you gave false information.
False information. Yeah. That was big mistake.
You said there is no constipation, but there is a history of constipation followed by diarrhea.
Diarrhea, yeah.
Presentation of acute appendicitis.
Yeah.
Initially, pain was on umbilical area. Now it's been localized to the pelvic area.
Pelvic area.
So initially it started from umbilicus, but now localized. And when the doctor said to you, are you sure pelvic area, this is appendix? That time I was expecting your answer like that. Yes, doctor, we are aware of that situation that 10% appendix can be on the pelvic area.
Yeah.
If you can't say the 10%, you can say few percentage of appendix is present in the pelvic area.
Pelvic area.
So that time the registrar will be shut up, you know, shut up.
Yeah, that's the time to show your background knowledge.
Yes, very good. That's the time to show him, I am also a doctor, not only you are a doctor.
Yeah.
Right? So whenever any colleague is very rude to you, show them your knowledge. They will be shut up. Okay, they will be shut up. So it's been localized to pelvic area. So you have to say that we know that there are some percentage of appendix that can be pelvic in origin. And the child had constipation. Now it's diarrhea. So it is not acute gastroenteritis. And the pain is gradually worsening day by day. And they did very well that analgesia is not working. You said it very well. I'm very happy that you said that. Okay.
Yeah.
And Ryan is developing high-grade fever with flushing of face. This is totally indicating of an inflammation. Because if it is a gastroenteritis, simple gastroenteritis, he will not develop high-grade fever.
High-grade fever, yeah.
Okay?
Yeah.
And then so you wrote a referral because previously you admitted the child thinking of gastroenteritis and UTI. But now you are thinking it is acute appendicitis. That's why you referred the child to the surgical consultant. And when we refer, we want urgent refer. We did urgent referral. And he was not picking up phone because this is not also his fault because he was in operation theater. He's on-call officer. Maybe this is time, not office time. This is like evening or night. He's in operation theater, emergency operation of another children or another doctor, another colleague. I mean, he's not like all time free. He's also busy. So he was not picking up call. He was not responding to your referral. Now he came to see the child, seeing your 100 calls and refers. When you shift it about to finish, that means you are now going home because your shift is finished. That time he came. And you still have many blood reports to chase. That means you have now your duty did not finish. You did not finish your work. Now you have to talk to him. So remember, this is the overburdened situation in UK.
Yeah.
You did not finish your work. There is another person come to you, talk to you. And he is behaving rude to you. So how you will react? This is a pressure point.
Yeah, this is a pressure.
Communication is a pressure point communication. Think about your situation that I'm now want to go home. This is already 5 o'clock. And I have many reports. I have to collect those reports. I have to send those reports to the nursing staff. I have to, many things I did not do. And now he came and now he's behaving like that. How will you feel? You will feel exhausted.
Yeah. In real life, very terrible.
You will feel exhausted. You will feel drained. You will feel like someone is sucking your blood. Isn't it?
Yeah.
Action is to talk, the surgical registrar, Paul. His name is Paul.
Paul, yeah, I haven't said his name. That's another
Yeah, that is
misunderstanding.
another point. Yeah, you did not say his name even once.
Even once, yeah. Actually, I couldn't get through the scenario. I didn't actually understand what's the scenario is.
It's a very easy scenario I gave. In
Yeah,
real exam, it was 10-line scenario.
yeah.
I gave you only like 1, 2, 3, 4, 5, 6, 7 line.
7 lines, yeah.
There will be 10-line scenario.
10 lines, yeah, yeah.
So it is very easy scenario in comparison to the exam.
Exam, yeah.
Because I made it and I'm an amateur. I'm a very immature person, neonate. So I made it for you. So this is the continuously denying. It's a surgical abdomen. He is continuously denying it. So you have to calm and quiet voice. You have to refer this patient. You have to understand him, make him understand that we are really worried. This is the problem of the child. Please have a look. Okay.
Yeah.
Supposed to take any history from the surgical abdomen, from the doctor, or any unnecessary information you cannot give. Like
unnecessary, like I said, the bloods and all those things. Yeah.
Yes, you said it, that blood report came, high WBC count. It was
Yeah.
all being written, all being judged.
Judged, yeah.
Not in the. I was preparing many questions for you, but you were so confused. You made it so like I could not ask you many questions. I prepared for you. Like I prepared for you. What is the urine result? If you did not get urine result, why did you refer to us? Because UTI is the most common cause of abdominal pain in children.
Yeah.
I prepared some question like, did you make him nothing per oral, or you want to make me to come and nothing per oral? Did you make it or not? So I wanted to show you some more aggressive behavior, but I could not because you are so afraid of the situation. So I could not give you more pressure. I could give more pressure for you.
Yeah, you realize that how polite I am and how afraid I am. Yeah. And ma'am, I have a question. Like they have written that now he came to see and your shift is about 2 hours. So at that point, can we say to him that my shift is gonna to be over and I have to...
No, never. You wrote the referral. You have to finish it. Because no colleague of your colleague will be agreed, because your shift is about to finish, not yet finished. You have time. Yeah. He came to see, so you have to do. Even 1 minute before your work, if some emergency came, you have to face that emergency.
Yeah.
That will be overlapping. Your next shift and you, both will be overlapped.
Overlapping, yeah.
That patient will be seen by both.
Yeah.
Okay? Your next colleague and you, both will be seeing the patient. But you cannot say, oh, my time is about to finish. I'm not now free. Oh, he will complain directly to Paul against you.
Yeah.
That I went, after my surgery, I went to see the patient and he was saying that I am going home.
Yeah. And the other thing is that even if after all this discussion, he is not agree to take the patient, then what we, in this situation, what we should say at the end that, okay, so we will call back to you later on, or we should talk to our consultant. What should we say? Like if he even till the end, he is not agree to take the patient.
You said one thing that I already discussed with my consultant. So you cannot go back to your consultant again. You already discussed, and it is pretty sure it's a case of surgical abdomen. So you can request him that, Paul, I understand you have lots of workload. I know you have lots of work. Appreciate that he is busy. Appreciate it. Okay. Maybe he's not faking you. Maybe he's not telling you a lie. He's really busy. So you have to say that, Paul, I appreciate that you must be busy. You must be overburdened. I really can feel that because we are also overburdened. So I request you that, can you please see the patient again? Because I am really worried, and I discussed this case with my consultant and we both agreed that this patient has acute appendicitis. So can you see it again? We make the patient nothing per oral already. So if I don't give food and I cannot make diagnosis, then the parents will be really furious, and it is not good for our hospital. It is not good for us.
Yeah.
So patient is already nothing per oral. Whenever any medical doctor in UK or any other part of the world, they know the acute appendicitis or acute abdomen, they will definitely put the patient on nothing per oral. So you already put that. No need to say this. You already put the patient, because now you are thinking it is appendicitis. Whenever you are thinking this is appendicitis, that time, then and then I will put nothing per oral. I will not wait for the surgical consultant. This is the guideline, NHS guideline of acute pain in the abdomen. I think it is guideline number 1. Only the green guideline, page number 1, first guideline, abdominal pain. Whenever in any abdominal pain, in any situation, if you're thinking it is surgical abdomen, you have to put the oral. And then you have to call the consultant, register, surgical register.
Yeah.
Anyone has any question? Oh,
Yes.
okay. Dr. Tara, yes. Let me finish his query, then I will come back to you. So after, first of all, Dr. Dr. Shabbir, I am very happy that you are very brave enough to do this scenario with me. It's very brave.
Thank you so much. Thank you.
And
Thank you,
second of all, you did very well that you did not shout your voice. You did not raise your voice. That is very good. You did not raise your voice. You were very polite, because I was raising my voice, but you did not raise your voice. We should not raise our voice when our colleague is shouting to us. Okay? We should call the manager, or we should raise it to our consultant, but we cannot shout it back.
Shout it back, yeah.
So this is the thing, and you did very well. But first of all, you said, is this the right time to you for talking?
So, I did the mistake here. So I was thinking that I am talking to the parents. Like I said, is it the good time to talk to you?
Yes,
so instead of that, I should say, I should say that, do you have a time if I discuss a child with you like this?
No,
kind of should I use?
No, you will say that, thank you very much for coming, and I know you are very busy. That will neutralize his anger, you know?
Yeah.
When you will say first line that, hello, Paul, nice to meet you. Glad to meet you here. I know I have disturbed you a lot today, but I really need your help. I really need your help. And it's very glad that you came here. I'm very glad. Just praise him. He will be flat. You know, he will be flat.
He will be flat, yeah.
You know, everybody likes praising. Even me too likes praising. Everybody likes praising. So suppose in my exam, there was an angry parent, that nephrotic syndrome child. It was discharged, parent was discharged. And then we called the parent back to hospital that we need to give you acyclovir because your child is nephrotic syndrome and he mixed up with another child that has chickenpox. So we need to give, So the mother was very angry. In the scenario, it is written that mother is very angry. So I was thinking in my mind that now I have to be very polite. So what I did in the beginning of the session, I said, suppose the name was Mrs. Sabina. I told Mrs. Sabina, I'm really sorry. I know it must be very difficult to you to come here because yesterday we discharged you. I know it must be difficult for you. And then she was saying, yes, doctor, see, you can understand me. But even nurse called me, doctor, and said, emergency, I have office to go. Okay? And she said, doctor, you are so good. You are so kind. You understand my situation. That is the technique, okay?
That is the technique right from the start.
Bam, right from the beginning that I will not let you be angry.
Yeah, moral victory right from the start, moral victory.
Thank you so much, So I told the mom that I'm really sorry to call you emergency, to call you urgently, and to talk to you at this time. I'm really sorry for that. I know it must be difficult for you. Yes, doctor. See, doctor, you can understand my situation, but nobody can understand my situation. So she was very happy. Okay?
Yeah.
She was blaming the nurse. And I said, actually, this is nobody's fault. She was provocating me that I will say, yes, the nursing staff has no knowledge. But I did not say that. I said, actually, this is nobody's fault. we cannot prevent your child from mixing with another child because he is getting steroid. This is not justified. Chickenpox can be in this room also, can be your home also. We cannot prevent him.
Yeah.
This is nobody's fault. So I took the medical side of my nursing stuff, right?
Yeah.
So that is not a partiality. I did the right thing because she's not at any fault. Now my nursing staff is innocent. Okay. So this is the thing, you have to be very, confident.
Confident.
Yes, you have to be very sympathetic. This registrar is definitely rude. He's very bad person, but you should not be rude. You should be polite with him.
Polite, yeah.
When he said, you should learn what is acute appendicitis and how to manage and how to call, how to refer. You should learn. That time you could say one interesting line, "Thank you very much. And it will be very nice if you teach me after whenever you are free."
Oh, that will be the much helpful line. Yeah.
Like give his medicine to him.
Yeah.
Give his medicine to him back. Like,
yeah.
It will be very helpful if you teach me some important tips when to refer, because I think I have deficiency. So it will be very helpful. Whenever you are free, I'm ready.
Yeah.
Give his medicine to him.
To him,
yeah. That will be very good. And it is allowed that you can learn from surgical registrar. Everybody is allowed to learn from each other. I'm learning from my manager, admin manager. They are not doctor, but I'm learning from them. So it is allowed to learn from everybody.
Everybody, yeah.
Yeah, so you can do that. I think it's done, right? Anyone has any comment? Yes, some people raised hand. Please ask me. Dr. Sara, please. Yeah, Dr. Nabila and Dr. Sara. Yes.
Yes, doctor. Your way in communication was very kind with this rude registrar, surgical registrar. Because if me, I will fighting with him.
No, you can't fight in exam.
But the thing you said finally, I like it, that we have to learn from him, and me he have a special tip to differentiate it from differentiate it, if it's right appendicitis or no. But the thing that I want to say for you, if my consultant, pediatrician consultant, said he suspected 90% it is appendicitis, and this registrar refused to come and see. In that way, what can I say for him?
He did not refuse. He did not refuse. He came, but after 100 calls, he came.
Okay.
He came here. See, one surgical registrar. Now he came. See, now he came to see the child.
Yes. Okay. Okay. I mean, if the scenario was different and he refused to come on that situation, what I have to say for him?
That will be a telephone conversation. Telephone conversation they will not give you now, because now there is no COVID. So they will not give you telephone conversation. They will give you this scenario face to face.
Okay. Okay. Thank you, doctor.
If he does not come now, then your job is easy. You will just write a complaint.
Incident report. Huh?
Yeah, incident report or complaint. It is not incident, it is actually a complaint. First of all, you will involve your consultant. Your consultant will call surgical consultant and complaint will be raised.
Okay, thank you, doctor.
Nobody can refuse referral in UK.
Assalamu alaikum, ma'am. I'm Dr. Nabila.
Yes.
May I ask my question?
Yeah, please.
At first, thank you, ma'am, for your wonderful session. I have been a student of you long ago, way back in 2014, yeah, I guess, in Bangladesh, when you were giving us lesson about the post-graduation preparation course, preparatory exam courses of FCPS in Bangladesh. I have been a student of you long way back.
I now remember. Sorry, dear, I lost all my...
No, ma'am, you don't know me. You don't know me personally. I was just a common student, and I have come across the FCPS exam with your Emar Khan, with the book Emar Khan you prepared for yours.
You
Yourself.
got the book?
Yeah,
Oh my
till
God.
date I carry your book, and I have given it to many people and
Really?
said that if you just cover this book, you will be it was a real help, ma'am. Thanks a
Oh,
lot,
thank
and I always keep you in my prayers, and I will be always. Thank you so much, ma'am. I had a query
you.
regarding the communication station.
Mhm.
Considering the given scenario, which was given today, do we need to ask for an attendance here? As like we've been taught that we should always keep an attendance in addition to the role player. Should we ask or give him preference that whether he needs an attendance or friends or colleague with him or not during this discussion or this meeting? Is it
Very good
necessary?
question. Yeah, it's a really good question, and I forgot this point. Thank you for remembering me. In difficult colleague scenario, in difficult teenager scenario, in confidentiality scenario, you should not take attender. Okay? Because this is a discussion about a patient between two colleagues. If you take one attender here, it will be like breach of confidentiality, isn't it? We are discussing
Yes,
about
ma'am.
the patient. So if you get another doctor here or another colleague here, it will be breach of confidentiality.
Yes, ma'am.
We cannot do that.
Thank you, ma'am. I had this query for a long time. Even there are some scenarios of some adolescent individuals like having diabetes or some other medical issues which they want, or some suicidal adolescents. There are some scenarios where they want to keep these issues secret from their parents. So in those scenarios also, we should not ask for attendance, right, ma'am?
You should not. You should not. But you should ask one. In UK, below 16 year, cannot go to the doctor alone without the consent form of the parent.
Okay.
Like I am in UK, my daughter is 15 year.
Yes,
So
ma'am.
I booked a GP booking for my daughter,
Okay.
and I told I was messaged by the GP reception that your daughter should not come to the GP alone. Either any parental responsibility will come, or you will write a consent form and send it by another adult. So in UK, below 16 year patient cannot go hospital alone. Okay? Either there will be a consent form by the parent, or another parental responsibility like father, mother, they will go. Or consent form will be signed and another adult will go with the child. So below 16 year, you have to ask the child, do you have consent to come here from your parents? You got my point? So this question is very tricky. So you have to ask the child like that. Are your parents aware about your visit today? I mean, directly don't ask about consent, but you have to ask, are your parents aware that you came to me today? Okay. So if the child tell you that, doctor, I don't want my parents to know that I came here because I am pregnant, or because my parents doesn't know I have a boyfriend and I want to come here for contraceptive advice. That time, what will you do? That is a very technical situation. You will write down that I could not take the consent of the parents because of the confidentiality arised by the teenager. She is not willing to take consent from the parents. You will write down in your note. And then you will ask about the boyfriend. What does the boyfriend do? What is the problem with the boyfriend? If there is any concern that you are aware that this child is abused sexually or physically or mentally, then you will refer this child to the social service people. You will refer to the social service. You will not refer to the parents. Parents cannot do anything. You will refer to the directly social service. Social service will go to the child, will talk to the child. They will go to the school. They will go to the home. You got my point? Dr. Nabila, you got my point? I don't understand. Where is he?
Yeah, I think she's
not here.
She
Oh, there, but she's
probably
silent. Yeah, she's silent. Okay. So in confidentiality, when the patient does not need or does not want an adult consent, that time you have to write down this consent. Okay. But usually below 16, we take consent from the parents by a consent form. Okay. This is the technical issue. Okay.
Thank you, ma'am.
Okay. Thank you very much. So we go to the next scenario, or anyone has any more question?
Yes, I'm Dr. Hajar. I have one question.
Yes.
In this scenario, can I tell him that if he is not willing to see the patient and he thinks that his assessment, this is not appendicitis, that he needs to write this down in the notes, and I'm not going to take the responsibility for it? Can we do this?
You are very good. MashaAllah, Dr. Hajar, you are very good. You raised a very important point. Yes.
Thank you.
Even if 100 times telling, the surgical registrar is not ready to willingly take the patient, he must have write down this note in the patient's form, in the patient's case history, that this patient has no sign and symptom of acute appendicitis or burst appendix. So continue the management as per advice. And he will go and he will talk to his consultant that, sir, I see this patient, I feel it is not an appendix, so I continue the management like nothing paroral for next 24 hours. Then start sips of water, like. You got my point? So yes, absolutely correct. If the surgical registrar is not ready, he will write down it. This is the protocol actually. Yes, you are correct.
Thank you so much.
Yeah. Okay, I think we finished it.
Hello.
Yes, hello.
Yes, yeah, hello, Dr. Tamanna.
Yes, Dr. Barnali,
yeah.
right?
Yeah. No, Aparajita.
Aparajita. You both have same voice, you and Barnali have same voice.
Yeah, you always confused us, yes. Congratulations for your success. We are really happy.
Alhamdulillah.
One of my suggestion is that should we here mention about the scoring system, clinical scoring system for appendicitis, that Alvarado, that is in the patient info. So out of 10, the 7, it is fulfilled, then it is surely surgical appendicectomy required. So
yes.
in this case,
yes.
So during argument, can you say that?
Yes, if you tell this to the surgical registrar, he will definitely not say you go back and read appendicitis, because he know that the doctor already know. Yes.
So it's better, no?
Yes, yes. So if you read from the patient info, every scenario, as Dr. Aparajita mentioned, that there is a patient info website, and in the patient info, there is a leaflet. There is a line that there is a scoring for acute appendicitis. You please, everybody go to the patient info after today's meeting and you see that scoring. And I will suggest you collect the recall folder. We have this in our groups. Collect the recalls and read every recall from the leaflet, NHS leaflet and patient info website. That is the best idea to pass communication scenario. Okay. I am in my course, I prepared like 50, 60 scenarios, 50, 60 different kinds of scenarios. I'll teach every kind of scenario, but I cannot do this full course with you guys. So I have to prepare myself, and I am suggesting you do same for you. Prepare yourself. Okay. So do this, prepare yourself from leaflet. NHS leaflets are very important. Patient info website is very important. And if you say this scoring to the surgical registrar, he will definitely agree with you. Yes, this is a surgical abdomen then. Yes. But I appreciate Dr. Shibbir. He said that we gave analgesic. It is not responding. That means pain scoring is high. Pain scoring, WHO ladder, pain ladder. It is severe pain to 10 because analgesia is not working. Okay.
Yes, because in this scenario, out of this, there are 3 for the symptoms and 4 for signs and 3 for investigation, like neutrophilia, leukocytosis for 2 and neutrophilia for 1. So other than blood, all are fulfilling. So already it is 7 or more than 7, even without the blood report.
Okay.
Excuse me, ma'am. If we mention the Alvarado scoring to a surgical registrar, then he may ask from us that, okay, so
The investigation. What is
yeah,
the investigation?
yeah,
Yeah.
what is the investigation? So because the scoring also include the investigation.
Yes, I know.
Yeah, so without investigation, even 7, na, out of 10, if it is 7 or more than that, so then it is definitely require appendicectomy.
Yeah.
So out of the 10, 3 is signs, like the fever, means nausea, vomiting, pain, migratory pain, and your anorexia, and 4 is for symptoms like your tenderness, rebound tenderness, and fever. So all these, even without the blood report, it comes to 7. Blood
Yeah.
has only three score.
Yeah,
Two
So-
for leukocytosis and 1 for neutrophilia.
Oh, then it might be very helpful. Yeah,
Yeah.
you're right. Yeah.
So if you know this scoring, guys, you definitely tell this. But even if you don't know this scoring, you can pass this station with full mark. You know, I am not a very knowledgeable person, but I know the technique to pass the exam. Okay. So this communication is not about knowledge. Communication is about a technique. Knowledge is only 2%. Or I'll say, not 2%, I'll say 2 point out of 10. I mean, if I give you 10 mark, 2 mark is for knowledge. That is only 20%. So 20% is knowledge, 80% is your technique, how you did this, how you convincing with the surgical register, how calm you are, how polite you are. Okay, this is about technique. And I never expected, actually, Dr. Shibi did so well. I never expected he will do so well. I thought he will break down, but he did not break.
Thank you so much. Thank you.
Okay, now Dr. Yasir. Okay. Dr. Yasir?
Yes, Dr. Tamanna.
Yeah, your scenario is easy scenario. I'll not give you difficult. Don't think always I'm difficult. I'm
not among the ones to run.
I'm giving you easy scenario, but it is important for our students. This is your scenario, Dr. Yasir, that what is the name? Name is what is the name? Jack. Okay. Jack is a medical doctor. Okay. He's a SHO, newly joined in pediatric department. So our consultant has given a task, a presentation to evidence-based medicine. Okay. So he has some question about evidence-based medicine. Okay. And he wants to know evidence-based medicine. He wants to know about the NICE guidelines. So you have 2 tasks. Okay. This is the thing. Now you take your preparation, 2 minutes, then we'll start. Okay. You are the pediatric registrar. Okay. And I am Jack. My name is Jack. I'm Dr. SHO. Yes, Dr. Yasir, are you ready?
Okay.
Okay, wait, I'm putting time for you. Yes, start. You know your name, right? Start.
Yes, yes.
Yes.
Hello, good evening.
Good evening.
I'm Dr. Yasir, pediatric registrar. I think we met Jack in the morning.
Yes, doctor. I'm Dr. Jack. Yeah, I know you because you are an excellent registrar. I see you in the round every day.
Yeah, thank you, Jack, and I highly appreciated an enthusiastic doctor like you, and you have choose a very good topic. So our topic is evidence-based medicine. So it's a nice time to talk to you.
Yeah, doctor, I have few questions about evidence-based medicine because our consultant is very studious and he wants me to do this seminar, but I don't know anything because this is my first word in pediatrics. I never done this thing. So if you kind enough to explain me this, please.
No problem, Jack, and I highly appreciate it. And I also like such keen person who are interesting. Actually, Jack, we comes to our point. Evidence-based medicine. Do you have any idea about before? What is evidence-based medicine?
I can understand this is something related with research and something related like treatment in pediatrics, right?
Yeah, that's great that you know something. So actually, Jack, I am here. Actually, what is evidence-based medicine? You know, these are three words. There and definition behind this one. It's related to any healthcare problem that we can manage on the basis of evidence, and then we treat that disease or the problem on the basis of evidence. So it helps us and it increases the research among the new people, and it helps to overcome the burden on the health facilities. Are you following with me?
Yeah, but doctor, I don't understand. We give treatment from books. We don't give treatment from research. So what is the difference between book treatment and research treatment?
Actually, the treatment that is given by the book, I appreciate your good question, that the treatment that is given by the books that we call them guidelines. And guidelines are made on the basis of the outcome of the researches that everybody unanimously agree. But research is that type of thing that we expect something that it could produce some effect, but we will see the outcome later on. But the thing that
Okay, now I understood it. So before the research comes, afterward it agreed by some people, then the guideline comes, then this guideline comes to book, isn't it?
yes.
Oh, doctor, you are excellent. You teach excellent. See how easily I understood. Now, doctor, I have another question, please. That these guidelines, as you said, some people agree. These guidelines, like I'm not from UK, I came from Holland. So we have same guideline of bronchial asthma in Holland. If I go back to Holland and I apply nice guidelines over there, is it good idea or it is a bad idea?
Yeah, Jack, your question is very valid. But every area has a specific guideline according to their people ethnicity and according to the environment and according to the availability and outcome of the drugs. So it's a very it's easy to say, but it is very difficult to implement.
Oh.
So I'm not in a way to say you that you can apply the thing that is normally using in UK and you can apply in the Holland. I think this is against the policy of the local hospital, local consuls. So I'm not in favor of using that one.
Okay, okay. Yeah, that's very good you said, doctor. Yeah, I understand. I agree.
Okay, Jack, we come towards this our evidence-based medicine. I am here to tell you something that actually evidence-based medicine is based on 5 steps. So have you heard about this thing?
5 steps. No, I'm really sorry. I feel I'm a dumb doctor, right?
No problem, no problem. The initiation is the only key.
Okay, 6
so,
minutes.
Okay, so you started, so no problem. I'm helping you. Actually, Jack, first of all, how can we make evidence-based medicine? First of all, we choose one topic, like suppose we can say that viral induced wheeze. We can choose. We can use the PICO formulation, in which P stands for pathology, like somebody has viral induced wheeze, while in I stands for intervention, that how we treat with steroids, with nebulization, and then you see the control, that how can we compare with the others, that what is being used in Holland, what is used being in other countries of that Europe, and then we are other part of the same different hospital of the UK, and then we compare them, and then we can find out a outcome, and then we can make we can discuss with other people, and then we will see the that this is implementable or not. If it is implementable, then we can see the outcome, and then we can put this thing in our, with all the consensus we put in guidelines. So are you following me?
Yeah, but doctor, it is very tough for me actually.
Yeah, I understand. I have given you too much knowledge, and it is a research always very dry topic. But if I can help you to understand, and I help you, guide you to make a presentation, so I will help you in this way. You can understand it in a better way.
Oh, doctor, you are really kind. I know how much busy you are, but you are giving me time and you are helping me. Oh, doctor, I can't say how kind you are for me.
Thank you, Jack. Do you have any other concern?
No, just I want to do this thing to be done. You know, I don't want my consultant to be, you know, angry on me.
No. I will help you. I will praise you in front of him, and I appreciate you. So I will have. So you will make a presentation, and I will guide you. So
okay, doctor. Yeah, that will be very great, doctor. Thank you very much, doctor.
Thank you, Jack. Thank you.
You finished? You finished? Thanking you? Okay. So you have already 30 seconds left. It's okay. 30 seconds is not a big deal. In exam, if you finished early, you will... Now your time finished, okay? So in exam, if you finish early, what you will say? You will not talk, okay? You'll just stay silent. If you thank and say goodbye, then you cannot talk, okay? Lastly, Dr. Yasir, I will definitely say that well done. You are excellent candidate for you. I have no doubt you will pass. I have not a 1% doubt you will pass. But you will get maximum marks in the communication, that I can't say. But I'm sure you will pass. And how to get the maximum marks, 8 on 8, there is some technique. I'll teach you the technique now. First of all, Dr. Yasir, your knowledge is mashallah. You know exactly what you are talking. I asked you many questions related to knowledge, like what is the difference between local guideline and international guideline? I asked you, what do you mean by book and book treatment, and what do you mean by evidence-based treatment? I asked you the difference and you said it very nicely. So knowledge, I have no doubt you have 100% knowledge, but there is some technical points that you missed. I will say like your voice is a little bit monotonous. I mean, you can say like, oh, Jack, I saw you in the ward and you are very good. So see the ups and downs of my voice. In UK, you know, they say like, hi, thank you, bye, like that. I mean, they like the tone this way. Okay. So your tone was a little bit monotonous. Don't mind, huh? I'm correcting you for your betterment. So you will just say that, hello, Jack. Nice to see you. I saw you in the ward. Did you saw me? Did you see me? Yes, doctor, I saw you. You are an excellent registrar. Oh, thank you so much. So you have to be a very, you know, that is called like, you should be very attached with the conversation. It should not be like an education scenario. It should be like a friendly conversation. Okay, you are a senior, he is a junior. So it will be very friendly conversation. So you will say like, hello, Jack, nice to meet you today. So Jack, do you want anyone to be here? Attender, you did not ask. Okay, so that is a small mistake. I'll not say here grave mistake. It is a small mistake, minor mistake. So number one was voice. You should be a little bit more charming and more, you know, ups and downs, ups and downs. Some voice will be up, some voice will be down, like that. Oh, really? Oh, like that. I mean, some drama you need, Dr. Yasir. You are not very good at drama making. Okay, girls are very good, but boys are not so good in drama. So you have to do some drama. And then you have to have attender here because it is a medical education. And you can say that, Jack, do you want any of your colleague to be present here today? No, doctor, actually everyone is in duty. I'm not in duty, so I just came to you. Okay, that's not a problem at all. Okay, that's not a problem at all. So you not need to say like me, not need to say like UK accent, but you should say, that's not a problem. That's not a problem. Number 3, don't use same language again and again. It is very monotonous. You said 4 times, I appreciate. I appreciate that you know what is this meaning, but you can change your words, you know. You can change your words. Don't use same words. So this is number 3 point. You can change your words like, oh, excellent. That's excellent. When the doctor was saying, doctor, so that means, first of all, it comes to research, then it comes to guideline, then it comes to book. Am I right? So that time you should say, excellent. Okay. You will not say like, I appreciate your knowledge. That feels very, you know, that feels very ice. You are like a ice. So you have to be very cheerful. Excellent. Yes, that is the thing. So that's the thing. Okay. You have to be very, you know, charming, and voice should be very joyful because this is the education you are teaching. In case of sad scenario, like death of a child, like, you know, withdraw from ventilator, organ donation, do not resuscitate, breaking a bad news, that should be very mild voice, not a cheerful voice, but it should be very cheerful voice. Excellent, like that. So you'll say like that, excellent, or well done, you understood it. Okay, so change your voice, change your words. That will be very good if you say. Number 4, Dr. Yasir. Dr. Yasir, think that if you follow this advice, you will get 8 on 8. In both the communication in my exam, I got full mark. In both the video, I got full mark. So I guess my communication was good. So please do follow this thing. You will get full mark. Definitely you will get full mark. So number 4 is, you said, wait. Oh, you are saying like, you know, what does this mean? If you say like, that means you are very shaky. Okay. The communication should be fluent. Like I'm talking with you now. There is no, there is no, You understood my point. So you cannot, you cannot do that. If you do that, it will feel like you are making sentence in your brain. Then you are speaking to me. There is no fluency. There is no, you know, there is no attachment with me. If you break that sentence, it will feel like non-attachment, unattachment. So try to speak a little bit more fluently. Like don't use oh. it's very, it listen very, you know, uncomfortable to the ear. So try to speak more fluent. Okay, try. I'm not saying you can do 100%. I can't do 100%, but you can try. We can try. Number five is wait, what I remember, just like tell you, the ending was, I felt you did not end well. You should end like, okay, Jack, so I know I'm giving, oh, yeah, I remember. More than 40 seconds you talked in last few sentences. You remember, Dr. Yasir, when I said you, oh, doctor, that's very difficult for me. I'm not able to catch it. Okay. So more than 40 seconds, you can't talk. So you have to break the pyramid. You are describing the pyramid, that is PICO model. You are describing. But when you have 6 minutes gone, at last 3 minutes, you cannot start a pyramid. You got my point. So don't start a new thing in last 3 minutes. Last 3 minutes called wrap up. You are wrapping up the communication. You are just summarizing your communication. You did not ask me to summarize. You forgot. Right, Dr. Yasir?
Yeah.
Yeah,
You
did not ask me to summarize. Summarize contain marks, at least 1 mark in communication. So you did not ask me summarize. Here you will get 1 mark cut down. Okay. That's why I say, Dr. Yasir, you finished early. Remember, in communication, when you finish early, that means you have not done some important action. You have not said all the thing. You give me leaflet. You gave me some material about the evidence-based. I can't remember. Did you give? I think no. You did not give. You said I will help you, but you did not give material. Whenever any junior, even in my hospital, when a patient comes to me, a mother comes to me, every time I give 1 leaflet, because I have all the leaflet in my storage, in my hospital storage. There is a rack. In the rack, there is every leaflet. So every kind of patient, I give one leaflet. You got my point? So you will give leaflet. But here, the leaflet is not so important. Here, the important is material. So you will give some study material. Jack, I have something for you. This is a very good book. This contains what is evidence-based practice, medicine. And there is a NICE guideline. There is a website called NICE. Have you heard that before? Yes, doctor. My consultant was telling today to go to NICE guideline. Yes. So if you go to NICE guidelines and if you search evidence-based practice, it will come to you. And in our hospital library, there is a collection of evidence-based data, evidence-based guideline. You can go through them. If you need any help, I'm here. Anytime you can come to me. Is that okay? Okay, Jack. I wish you all the best in your near future. I wish you all the best. You did not say that. So I said did you end it? You said just thank you. But you have to say all the best because it is a junior coming to you for a guideline. So you have to say all the best. So ending was not perfect. Okay. Then 40-second break was not very good. Last minute, you said like 1 minute talking. Okay. And I did not understand anything. You did not break in between. Summarize, you forgot. And materials you did not give. So there is a lot of improvement. I said if you follow this, inshallah, in your exam, you will do definitely good. Definitely you will get full mark. Okay, Dr. Yasir? It's a lot, isn't it?
Thank you, Dr. Tamanna. Thank you.
A lot. Sorry, I'm sorry, it's a lot. I'm really
No. A strict teacher keeps a good students always.
Yeah, I'm really sorry because this is for your goodness, because I followed this in my exam. I was always criticizing my communication because I have lots of recording in YouTube. So when I listen my YouTube, my voice, I said, it is not good. I did not do well. So I criticize myself more than I criticize you. You know that? Before my exam, I was listening to my own recording and I was saying, it is not good. It was not good. Okay? Okay, done.
Ma'am, I have a question.
Yes. Yeah.
Do we need to explain some pyramid in here if there's a time? I think we don't have a time to explain a lot about pyramid
Yeah, that's what I was saying. Yeah, you don't explain a new thing in last 3 minutes, because in last 3 minutes, what is your action? Your action is to summarize. Your action is to give leaflets, materials. Okay. Your action is to praise, right? So in last 3 minutes, you cannot start any new topic. You cannot start pyramid. You cannot start Pico model. In last 3 minutes, you can't. And remember, the leaflet we are reading, the topic we are reading from books, exactly same situation will not be happening in your exam. Your exam will be dependent on the role player, what question he is asking you. So your role player is the main person who is, who is the main responsible person for your pass or fail. If your role player is very difficult, you will fail. If your role player is very easy, you will pass. So it depends on the role player's question. So here, the last 3 minutes, Dr. Yasir should not start Pico model, should not start pyramid, because it is already bell has been ring. So you should tell that he has a very important question that I should tell you that in the evidence-based, there are some A, like ask, acquire, right? Dr. Yasir, you are describing this, ask for a Pico model, acquire knowledge, appraisal, like that. So you can say one word. Don't describe it, because there is no time to describe it now. Okay. So that is the thing we discussed. We did 2 communication today. And I must say, Dr. Yasir's knowledge is far, far better than me. He said very good points. Like he said, why in Holland, the guideline, NICE guideline is not applicable, because the ethnicity, the medicine, and the people and the belief is not same. And the environment, he said 5 things: environment, ethnicity, medicine, people, and belief. These are different. Okay, 5 things are different. So Dr. Yasir said it is, according to me, it is not a good idea to follow NICE guideline to Holland. But we can say this line in a nice way, that that's why local guideline follow is better. Follow local guideline. Okay, because one country and another country is different. The situation is different. In Bangladesh, we don't follow NICE guideline. We follow Bangladesh guideline. Okay. So that is the thing, that local guideline is far better than the international guideline. Okay. But this local guideline should be a standard guideline. It should not be like any general guideline. It should be very standardized. And guideline changes every year because it is monitored. If the guidelines are not monitored, it will never change. It will be same 100 years. But you can see the MRCP students, you can see previously there was blue guideline, then red guideline, then green guideline, now light green guideline. I saw 4 guidelines in pediatrics. I saw 3 guidelines in neonate in my MRCPCA journey. Okay. So I'm very old person. So you see every 2-year guidelines is being changed. Why? Because they are monitoring. They are monitored. If the guideline is not monitored, it is not a good guideline. That's why every 2-year guideline is changed in UK. Some change, not all. Only some part is changing because they are being continuously monitored. Okay. So yeah, mashallah, it was very good, Dr. Yasir, to have a communication with you. I feel blessed. Okay. Any question for this scenario? Any question? Anyone?
I have a question of different scenario. It's not about this scenario.
Yeah, Dr. Asha, you had some question. And I think Dr. Saima has some question. Dr. Saima is here. She had some question. I told her to ask me in the free session, because she told me to describe, but in WhatsApp, how can you describe? So that's why I told her to ask here. Now, yes, Dr. Asha, please. Yeah.
One question about communication station, like a new baby born, and shall I congratulate to the mother that time, like any syndrome, I have to discuss about this matter, any heart disease. So is it a good communication initially if we congratulate the mother? Because we have seen in the books, they have written there.
You mean hypoplastic left heart?
Yes, ma'am. Any Down syndrome with heart disease or any syndromic baby?
Yeah, you mean 23-week baby? You mean severe hypoxic ischemic encephalopathy baby, right? You mean this type of babies whose life expectancy is very little, right?
This scenario, and also, ma'am, actually, I'm talking about simpler one, as because I'm going to give DCS exam. So
Yeah.
Any newborn baby, actually. That's
any newborn. If he is alive, you can congratulate the parents if he is still alive. Because whenever a child took birth, we are hopeful that the child will survive. And nowadays, the survival rate after 23 weeks is almost 70 to 80% in UK. The data is improving day by day. Previously, it was 50 to 60%. Now it is 70 to 80%. So any baby who born alive, that is called live birth, you can congratulate.
okay.
If he born dead, you cannot congratulate. Okay? Even if it is hypoplastic left heart, even if it is hypoxic ischemic encephalopathy, even if it is Down syndrome, you should congratulate. And this, I'm not speaking, this is from the UK courses, Ghosh courses, Evelina courses. They say to congratulate. Okay?
Okay, ma'am.
Okay. Anything? Actually,
that is...
I did not do any course. Personally, I never did any course, but my friends did, and they shared this with us that, yes, you can congratulate.
Okay. Okay, ma'am.
Yeah. Any more question? Thank you for your question. Okay, I have finished. So wrapping up.
Doctor, would I ask you a question?
Yeah, sure. This is an open platform.
Thank you so much. Thank you for your effort at the beginning.
Yeah,
I really appreciate it. How could I manage as much as possible of the subject that I can expect to bring out in the exam? You know, I'm just afraid of surprising elements. So
I mean, you are saying that in a short time, how can you take preparation? That is what your question.
Not in a short time, but at least how can I manage as much as possible of the subject that is that they bring them in the exam, most common subject. Is there a most common subject that they bring them exam frequently, or you can expect anything?
You can expect anything, number one.
Yeah.
Okay. I gave Nepal exam in 2022, September. I passed after four weeks, and I did not expect they will give me tuberous sclerosis with autism as a general examination. I know neurocutaneous they give, but the child had autism. I could not examine the child. I did not expect this. Okay, so anything can be given in exam. Okay, number one. Number two, if you see last 5-year exam recall, that is in our groups, every groups, I have shared one link with you. That is an open link. Anybody can share that. That link contained the recalls. I uploaded already. Okay. Sharing these recalls actually not good for the RCPCH people. They actually don't allow it, but they know that these recalls are so vast. Even if I share, you cannot finish this. Am I right? Even if I share, you cannot finish, because this recall means full book. If you see the abdominal recall, there are 120 recall. If you see the respiratory recall, there are 100 recall. If you see the musculoskeletal recall, there are 50 recall. That means what? Full book. So recall is full book. But if you follow the pattern of recall, like what I said, that this exam is not a hard exam, but it is a technical exam. You should be very technical. You should be very, very smart. Work smart, not hard. So you should be very smart that which station is coming frequently. I mean, suppose you are seeing the abdominal recall and you saw that only splenomegaly without jaundice, without pallor, can be a case of thalassemia or E beta thalassemia. That is a case. That was my case. It is a recall. So you have to see the pattern. Like a VSD, MR, mitral regurgitation, is a differential diagnosis. atrial septal defect is a differential diagnosis. So that is a recall. Okay. So if you see the recall, you will know the pattern of question. There is a particular pattern, but every 5 years, this pattern changes. Why? Because the examiner changes. Suppose you are now examiner. You like MSK, musculoskeletal, but I am the examiner and I like neuro. So I'll try to give more neuro cases. You will try to give more MSK cases, isn't it? Because you like MSK. So when the examiner is changing, the station's also changing. Okay. So you cannot predict the exam. People may understand that Nepal exam. Oh, one of my doctors said, oh, it's a Nepal exam. So it is not a UK degree. I said, no, it is a UK degree. Examiners were from UK. The patients were from Nepal, but the examiners were from UK. And the standard of exam was UK. It is not a Nepal local exam. He was thinking it is a local exam. I said, no, it is not a local exam. It is a British exam. And the degree I got, that is the UK degree. Okay. People think that only UK students get UK degree. No, this is a UK exam overseas. Okay. So don't underestimate Nepal center. Don't underestimate Egypt center. Same exam, because the examiners are same. Questions are same. Okay. All
have the same value, I think.
Same value, same,
Yeah,
same. Yes. And communication I did with 2 British examiners. They were all British people. They were not Nepali people. My communication, one mother, she was British white. Another was one British doctor. Okay. Both were doctor. Both the mother were doctor. So I gave 2 British communication station. Okay. So that is my understanding about exam and my advice about you. And
thank you so much.
Yeah, welcome. Yeah.
Yeah, I have a question. Like if you are sitting for exam in Nepal or some other countries, non-English speaking countries, then you need to conversate with the patients in English, or you can conversate with the patient in the local language.
Actually,
like,
I knew the local language. That's why I spoke the mother and the child with the local language. But suppose your exam is in Jeddah, you don't know Arabic.
Yeah.
That time you will speak in English, examiner will translate for you.
Okay, yeah. I got it, yeah. Okay. Thank you so much.
Welcome, most welcome. So we finished. Let's study now, study hard. And I wish all the best for all of you who are sitting here, studying, struggling for exams. I wish you all the best. And my number is this one. You already know my number. I know most of the people here know my number. So this is my number. Again, I'm giving you. If you need any help, anything, just post in the group or post in my number. And if you are interested in the course, I'm not forcing anyone. This is not mandatory. You can pass without my course. But if you are interested, you can contact me on my personal number. This is my WhatsApp number. Okay. Thank you very much for joining. It was so enjoyable. And Dr. Yasir, Dr. Shibbir, thank you very much for participating.
Thank you, ma'am. Thank you for providing us the opportunity. Thank you.
Yeah, thank you. Okay, all the best. Study hard.
Thank you, ma'am.
Assalamu alaikum.
Thank you, ma'am.
Thank you.
Good evening. Thank you.
Thank you.